Hi, I'm Isabel, and this is my presentation for my research proposal. So the main overview of the study is going to be about aquatic therapy in relations to children with cerebral palsy. So my research question is, how does aquatic therapy impact neuromuscular functions in children with spastic cerebral palsy? So just a bit of background information, about 1 in 345 children are diagnosed with cerebral palsy in the United States. Cerebral palsy is one of the most common motor neuromuscular disorders in childhood, and there is no evidence to exist that brain damage can be reversed, or there is no known cure for CP. And aquatic therapy is a relative new form of physical therapy. It is seen, to greatly improve balance, gross motor functions, and more. So that's kind of just the general consensus of why, cerebral palsy is a prominent motor disability in children, and how aquatic therapy kind of can change it. And we'll dive more into how aquatic therapy is going to be this new form of therapy that could help children with cerebral palsy. So this picture kind of just shows how kids with CP would look like if they were doing aquatic therapy. Obviously they're doing some form of it here. Later on in my research per presentation, I do talk in the approach section about how there will be aids in the water, like how they're seen in this picture, helping these children. A lot of them cannot sit upright on their own, but it just kind of, there is more applicable effects that, aquatic therapy can have in these children with cerebral palsy. And so this is kind of just a glimpse into how, it would look like going into my study. So first, we're also going to dive a little more deeper into aquatic therapy versus regular ground physical therapy. So like we mentioned before, there is no known cure for CP. So a lot of oftentimes that the reason why these children with cerebral palsy, they need to get on it with physical therapy is because it can help improve their quality of life better, because they will be able to do more of these daily, functional activities. So that's why you want to get them started right away, because physical therapy does get harder for these children with CP if they start on later in life. However, when we're introducing aquatic therapy, why aquatic therapy is seen to be much better, because studies have shown that that aquatic therapy, due to the water, has buoyancy and hydrostatic pressure, which decreases the gravitational pressure and helps reduce the joint load, oftentimes a lot in these kids with CP. So exercise in the water is seen to increase some postural support, reduce joint loading and impact, and improve muscular strength for children with CP. Physical therapy, on the other hand, while it is seen that it does seem to aid children with cerebral palsy, and it can often be difficult to perform these exercises due to that gravitational pressure. And so if, the child does not want to, perform PT because it hurts their joints and it hurts their muscles and they're not having fun time, then you're going to get less participation on the client's part, which then is going to decrease their level of improvement in physical fitness and just kind of hinder them in the long run when they're trying to improve their quality of life, but they can't really do these functional activities because they stopped PT because they didn't like it. So a lot of times enjoyment is a big part, especially since we're dealing with kids. And specifically in this research proposal as well, is that if kids don't like something, they're not going to do it. So for sure that, aquatic therapy seems to also have these enjoyment effects, which is, very good for these children because it makes them want to come back, and then that helps them in itself. So therefore, the long-term goal is going to be, to offer an alternate form of therapy to further aid children with spastic cerebral palsy accomplish tasks in their daily living by improving motor functions through aquatic therapy. So, usually the only route was, PT only. However, when you give kind of, the client and, the parents of these clients alternate, treatment options, it's able to be like, well, they can choose what they want better for their kid. And if they kind of make their own choice, then the kid might want to, or like the parent might be more pushy into like getting them started on this program. So you want to also make sure that the parent and the client also feels involved, because then it'll further help them aid in their health and their quality of life in the long run. So having enough data to say that aquatic therapy is going to be good for these kids, to offer them that alternate option, is going to be super significant. Our central hypothesis outlining the study is that aquatic therapy performed by kids with cerebral palsy will improve their neuromuscular functions such as balance and range of motion, thereby leading to advanced quality of life seen in their performance of their daily activities. So like we kind of mentioned before, if they're able to do their daily activities such as getting out of bed and like maybe brushing their teeth or like picking up a spoon to eat, they're able to do those tasks that are already difficult for them right now and just improve those activities easier. It is going to advance their quality of life and increase their mental and their physical health as well. So our three specific aims that are in relation to our central hypothesis is number one, we are going to observe and assess the neuromuscular functional skills in children with CP after a couple weeks of aquatic therapy. We're going to compare aquatic therapy as an alternate form of therapy, a physical therapy to help functional kids and children with CP. And then we are going to expand research on a relatively new topic of the effects of aquatic therapy on functional mobility. So, like we're just going to refresh a bit of kind of background information on why this is so important. It is a complex neurological defect and it interferes with those motor functions, often affecting daily activities that we may be like, oh, it's so easy. But to them, like I mentioned before, picking up maybe a spoon to just, eat your food could be such a hardening task for children with CP. And so there is a lot of symptoms that's come under CP. The main common form of cerebral palsy that most people get is spastic, which is why my research is focusing on that because that will include a higher population. The main impairment in kids with CP is that affects, muscular functions such as spasticity, muscle contractures, discoordination and weakness, and a lot more. So this is an important problem because, like we mentioned, that it is diagnosed often. About 1,345 kids in the United States get diagnosed with it. It's a complex disorder, but also I think the main reason why it's so important is because there is no known cure and there is no evidence to exist that you can reverse that brain damage, therefore leading to this being kind of the only way you're kind of, living this life to kind of figure out how you can live it better because there is no known cure. So it's really important to kind of show what kinds of therapies you can do just to help children with CP live a better and a longer life. And so the gap in literature is what you're discussing is, like I mentioned, there's only about two known studies that show the impact of aquatic therapy on children with neuromuscular functions, and they're not really linked to CP. One does show kind of the impact that aquatic therapy versus land therapy, and how aquatic therapy mixed with that land therapy was the best treatment option for those children. And then the other one kind of just dives into children with juvenile arthritis. And so that kind of is a different form of how it affected, their daily activities, how arthritis impacted their range of motion. So it's not also really targeting cerebral palsy. So kind of showing how aquatic therapy specifically works on children with CP is super important because there's not much known literature out there. Why this gap is important to solve. Like we said, the importance of having just an alternate form of treatment that these clients can choose that can potentially also be way better on their muscles, on their joints than regular ground physical therapy is super important. It not only can improve enjoyment, improve these motor functions. If something goes on where, let's say, a kid really likes PT, that's good for them, but someone is having such a difficult time, but we're like, that is the only way that we can think of how to treat you. That is not really good because, you want different treatments for different people because not everyone is the same thing. So kind of just providing that alternate form of therapy is going to be super just, I think, important for, the parents of these clients and these clients themselves. And so the expected contribution is, we're further going to aid children with spastic cerebral palsy in order to, accomplish their task in their daily living, further improving their quality of life. And so, like we said, the positive effect is that giving them an alternate form of therapy for kids with CP to choose from, for the parents to choose from. They are going to then get seen increased mental effects because they are going to, I think, enjoy it more. There is some studies that said that, children with CP were increasing levels of enjoyment as they were doing aquatic therapy due to its newness, a new environment, a new community that was formed from it. And so there's all sorts of positive, mental and physical health aspects that come with, doing aquatic therapy for children with CP. So just some innovations, the idea that kind of went behind all of this stuff that led to, us diving deeper into aquatic therapy is, like we mentioned, not much studies done specifically with children with CP on aquatic therapy. So we're digging into that and also developing another treatment option to help these kids, improve their better life. So this just shifted current research proposals because there was, like we mentioned, we saw there was a study with arthritis and just comparing ground physical therapy versus regular aquatic therapy, but there was no definitive conclusions from those studies on positive impacts aquatic therapy can have on specifically children with cerebral palsy, or getting more specific with spastic cerebral palsy. So that is basically how we are shifting it. So some novel concepts and approaches, like basically how we're going to be measuring these things, is we're going to be measuring using the gross motor subscale of Mullen's scales of early learning, also known as the MSEL, and in order to get an understanding of all of these, enjoyment and quality of life, we're going to do qualitative interviews to examine on the impact that, aquatic therapy can have on one's mental health. And so some refinements of the study that we're doing is a longer duration of a study to fully examine the effects that aquatic therapy is going to have on neuromuscular functions. So here's my overall study strategy. It's going to be a non-randomized experimental design. So you're going to have the primary comparison is going to be the measure of neuromuscular functional activity after aquatic therapy between traditional rehabilitation. So we are going to have an experimental group, which is going to be children with spastic cerebral palsy being involved in aquatic therapy for about a 6-month study. The reason why the study is so long is also previous studies were only about like a couple of weeks. They're very short term, so that's why you couldn't really establish the overall effects that aquatic therapy had on these children. So therefore, making it a longer duration of the study to then help make those refinements to help improve it. And then the control group is going to be just traditional rehab, people just doing regular ground physical therapy, just kind of comparing the two to see if there was any, greater impact that aquatic therapy could have over just regular PT. And so that's why it's going to be a 26-week study. Over the course of that's also equivalent to about 6 months. And they're about to get 60 minutes of daily exercise that might range. That is what it is right now. It might just go from back down to 30 to 60, but that is what we have. And it is excluding Saturdays and Sundays. So it's technically just going to be 5 days throughout the week. Inclusion criteria, I want about 20 to 25 children with spastic CP. And then the ages are going to be 5 to 15 years old because I want to mainly focus on kids. So that's why, but we are leaving kind of a wider range because getting also children with CP is quite difficult, to find someone that is willing to participate in the study. So we are hiring the age range. And the exclusion criteria is no known surgery 6 months prior. I don't mind, having kids with CP that have developmental delays, that have maybe like other that could hinder them, or because I think also we can look into these children with developmental delays to see that if they have CP and how it even helps them furthermore. So how the data will be collected, basically the baseline measurements is going to be the gross motor subscale of Mullen scales of early learning. And we kind of already talked about that, but 2 total measurements will be taken of the patient's gross motor skills. So right when they first get there, we're going to have a baseline measurement of both the experimental and the control group. And then I am going to be taking weekly screenings of the gross motor skills test. So after the first week, we'll do it again. After the second week, we'll do another measure. And this basically gross motor subscale breaks everything down into kind of like the simple, gross motor skills like jumping, running, like all that kind of stuff. So all that is going to get tested: balance, range of motion, and seeing how on their scale on how well that the child can perform that stuff. So I want to kind of see, if there's a gradual impact that any of these things are going to be doing. So at the end of the 26 weeks, we should have about 26 screen recordings of all the children's gross motor skills using that baseline measurement. So when looking at the statistical analysis plan, the alpha area for the primary endpoint was set as 0.05. So if the p-value is less than that, then that means it was statistically significant, and that the people who participate in aquatic therapy and had improvement in gross motor functions, then that is significant. Oops, sorry. So potential problems is that this is technically a small sample size to not really see. We did have a longer duration of the study, so that is good to fully see the impacts that aquatic therapy has on children with CP, but the sample size is pretty small, so you can't really get kind of a good view on how this impacts, many of these children with CP, because like we mentioned, everyone is different, so that does hinder it. Also, there's really only one scale of measurement, as it's kind of hard to measure, neuromuscular functions or these gross motor functions, but the MSEL is a really good one. But maybe if there's alternate forms of ways that we can do it, and we can use those to just further, get more measured, it's to use it. So otherwise, it was a super good study because it allowed for a direct comparison to aquatic therapy and ground physical therapy and how this both help neuromuscular functions in children with spastic cerebral palsy. So in order to establish the feasibility, how do we get the study to get going? I was thinking we could do a lot of interviews with families and special needs programs at schools with children who have CP to see if they're willing to let their child participate in this aquatic therapy program, to see, how it could further impact them, for the better. There is some high risk aspects, as we, children with CP do have developmental delays, which often could make maybe, getting into the water difficult, maybe with their aid or their trainer in the water with them, they might be difficult, they might lash out. So definitely there might be a day where they're like, my child cannot come because they have behavioral issues, they have behavioral problems. There is maybe some sensory issues going on. A lot of these kids with CP do have other, developmental delays, other, developmental learning disabilities that are going on the side that could then lead them to not really participate in the study, which could make some high risk aspects. And also if they have slight health problems, that then can prevent them from ever getting into the water, then that can also then lead to them not being able to participate. These are my references. And thanks. If you have any questions, feel free to comment under the DQ. Thank you for listening to my research proposal. Bye.